A very good morning to you, MEC. How's it going to work?
Good morning, and we are going to start today. We are doing a big dry run with the Premier in Alexander in Stratler, where the gentleman was found to be positive. The issue is that we want it to be systematic and to be focused and specific so that we don't go at random in many areas. We focus in areas where there is a general number of contacts around there.
Okay, how exactly do people qualify for this sort of test?
You'd remember that when you do the contacts, you would actually have to do those who are in high risk, particularly those who have spent a lot of time in the guidelines. We talk about 15 minutes with a person who was exposed to the virus or was found to be COVID actually positive, and then we will then disaggregate from that point going down to those who have got low risk. But the issue is just to make sure that we are able to clear a community going forward. So that's how it's going to work. So we're going to test those who have spent a lot of time with the contact, and then we go to those who have spent less.
I should imagine that this involves going from door to door. Is it going to be as sort of close in contact as that?
Yeah, so we will be, providing enough PPE for our people and for the people who will be doing the door-to-door to make sure that we protect our health workers. I've always mentioned that, emphasize the point that we need to protect our healthcare workers. They are the only asset we have to be able to fight this pandemic. So they will be having enough protection.
Tell us more about this protection, because there is a lot of concern that those on the front line don't have what it is that's needed to keep them safe.
It is not enough, but we are putting all our efforts in making sure that we get enough. And we also ask for people to be as logical and as rational as possible to use what is required for a particular procedure or a particular process, so that you don't find somebody who will demand a high level of PPE just for doing a triage on the gate. So there are different ways and specific things that you have to wear when you see a patient in casualty and when you actually treat a patient who's actually infected, because there must be a bit of rationality as it comes to the usage itself.
Can you give us a sense of how many people you will be seeing on a daily basis, and what happens if you find that they have contracted COVID-19? What happens to them?
We are going to, like today, we are hoping to cover close to 150 people who have been in contact with the people that we are talking about, the patients that we're talking about in Alexander. And after, when we have discovered that they are initially positive, and then we will then transfer them to a facility where we are going to isolate them. But if there are those who are negative but with a high propensity of them being actually positive, we'll then also take them to a facility for quarantining. So it's something that we are going to do and try to do it now. It's a dry run. We take it as a dry run today and see how other flaws, if there are any, we can be able to improve them going forward as we unroll the testing plan.
MEC, will you also take this opportunity to speak to people about the social distancing that's needed, about what's required, the health steps that needs to be taken on a daily basis? And I should imagine you'll also be hearing a lot about how putting this into effect is almost impossible in many of those areas.
Yes, I think we've realized that in many of the areas, particularly in the areas like Alexander, Deep Sloot and others, you find that it's very difficult. In actual fact, we are asking people to stay indoors whilst they stay in a one-shack room, in a one-room shack. But then the issue is that we need to try. I think the issue is that we have to try our level best to a point where maybe we might not be able. So we must not have different rules for different people. We must just put an effort as South Africans, as Gautengers, to make sure that we just exercise proper social distance and also limit our movement across, the township and across the province.
Do you expect people to be reluctant to be tested? I mean, will there be any sort of pushback? Do they understand what needs to be done?
I think, as I said, that it's a dry run. We are also going to get our community leaders involved so that it also becomes an exercise where we are talking to them and also educating them, so that continuously we will be, educating them and also trying to get some form of acceptability. But yes, indeed, we do, I think, anticipate that there will be people who will be actually resistant, but we'll try by all means to gently persuade them to be able to agree to be tested. It's only for their safety. It's also, again, for their actually well-being.
All right, Bandile Masuku, thank you very much for talking to us.